Tuesday, October 28, 2025. I'm Dr. Duke Majan, CEO and founder of Duke Spine Institute. Our patient comes from Wisconsin. He has had back pain for years. It's gotten worse in the last 6 months. He also has pain in his left leg from pinched nerves in his spine. We're going to go in and fix the back pain. We're going to fix his pinched nerve leg pain and hopefully give him a better quality of life. So he suffered with pain for many years. He did not want invasive spine surgery. He opted for the Duke laser disc repair, which is a far less invasive procedure. It's outpatient as opposed to inpatient with invasive spine surgery. There's no cutting the patient open. It's done with a small incision arthroscopically. And our patients always go home about an hour or two after surgery. So he's going to end up not going to Wisconsin. He's going to go to the hotel where he'll stay overnight, and he'll come back in the morning for a quick checkup with his lovely wife. Then they're going to head back home to Wisconsin because they don't need to stick around. They just come in, get the surgery done, go home the next day. That's how these procedures are. They are outpatient. Now, we've been performing this particular surgery, endoscopic laser surgery, on the spine for 20 years, over 20 years. And endoscopic spine surgery itself has been around longer. It's been around since the 90s. Shot. All right, that looks really good there, Jordan, on the lateral view. Stay there for a second. Shot. What we're doing at this point is we have to get into the disc to repair it. And to get into the disc, we have to go from the side of the spine because we're not removing any bone or ligaments. That's what makes this procedure so special. No bone is removed. No normal bone is removed. Every other spine surgery out there, laminectomy, discectomy, fusion, they're removing normal bone. We don't remove normal ligaments that hold your spine together. With this procedure, every other spine surgery that doctors offer you, they're removing normal ligaments, normal tendons, normal bone, and normal muscle. Not with this procedure. This is unique in that we can actually fix things in the spine without opening you up and removing normal things. All right, if you have questions, feel free to ask. In the meantime, Henry, let's show the audience the 30 different causes of back pain. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. All right, welcome back. You can see from our video that there's 30 different causes of back pain. All right, are you having any pain?
Are you having any back pain right now, sir? Yes or no?
How bad is that on a scale of 1 to 10? I mean, it's not acceptable to keep doing this. I need to have a number. I need a result.
Can we look at the report?
Right, Berndes?
Yeah, I agree.
All right, let's show the audience how we treat this disc pain with the laser.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK 349-6922.
We are back.
All right, so let's go to a testimonial.
Copy that.
And good morning, I'm Dr. Duke Machen. 30 years of back pain.
Yes,
Gone
sir.
overnight.
Yeah, overnight gone. It was amazing. I've been dealing with it, suffering. If it wasn't for my faith and belief and my friends back home that supported me, my wife, I finally got here to the Duke Spine Institute, and what an amazing experience it's been. Had surgery yesterday. I'm up walking around. I feel great. My pain was usually from a 6 to a 10 out of 1, if that. And I'm just so grateful that there are gentlemen in this world that really care about people like Dr. Duke, and I can't thank him enough. I recommend this gentleman to anyone who's been suffering and doesn't know where to go for help. You know, I live in the state of Idaho. It's a great place to live, but probably one of the worst states to get hurt in.
Well, we are happy you're here in Florida to get your back fixed. And we did the Duke laser disc repair on your back and the Duke plasma rhizotomy on your facet joints. And you had had a fusion done before, is that correct?
That is correct.
And we saw in your video when we were doing your laser surgery, you could see all the screws and rods, and you even have a broken screw at L5 on the left side, I believe. How do you feel comparing your fusion surgery with the Duke laser disc repair?
There is no comparison. 100% different. The fusion didn't help me, made me worse. It gave me a heart complication that I still deal with. But since I've been here, the people are outstanding in this facility, and I can't praise them enough. And Dr. Duke is truly a godsend for people that are suffering. I can say 100% honesty that I feel totally different person. I'm just so glad that I came here.
How does your wife feel about your new back?
She loves it because she knows I've been dealing with pain and depression. It's a hard thing to deal with. You know, it almost took my life. But like I said, with my belief in our Father and His Son, Jesus, has kept me here.
Amen.
And she's a big part of that. You know, I got to thank my friends like Dave Bowden, Dan Arnold, and Brad Russell. Those are truly my childhood friends that never gave up on me. People judge me on how I look, not how I am. And I'm a very compassionate person like yourself, and I want to help other people. I can't suggest Dr. Duke and his team here are world-renowned, outstanding, and everyone's so kind. I'm just so happy, you know, to have you on my side, and I can't thank you enough. You know, thank you, sir.
Praise God.
Amen.
And thank you for having faith in my team and our ability to help you.
Yeah, it is. It's they're, like I said, they're world-class people here. You can't go wrong. At least for myself, I'm just ecstatic. It's, you know, can't put it into words when you have no pain. I love it, and I'm just so glad that everyone helped me who was involved with me getting here, because I didn't do it on my own. I thank you all.
Well, thank you for sharing your story. I know it means a lot to people out there. We just want people to know that we can now fix back pain, neck pain. They just have to come here to Duke Spine and get the right treatment done, and we'll help them tremendously. Enjoy your travels home.
Yep.
And enjoy your new back.
And I shall. Thank you so much.
Yes, sir. It's my pleasure. All right. Welcome back from our animation and our testimonials. So from the animations, you can see there are 30 specific causes of back pain that are now known at Duke Spine Institute, but not elsewhere. And because these causes are not understood by most doctors, if you are in back pain or neck pain every day, you go to the doctor, they won't be able to cure you because they don't know where the pain is coming from. You know more about back pain than they do after watching our animation. The reason for that is that until now, back pain's causes have been a mystery to doctors and scientists and the world. Nobody has figured out what causes back pain, and now Duke Spine Institute presents the 30 causes of back pain for the first time in the world. In the history of the world, we're the first to discover the 30 causes, the first to publish the 30 causes, and the first to be able to cure the 30 causes. What you're watching here, this surgery, is available only at Duke Spine, and this is a surgery that cures back pain. It's a one surgery and a cure, not pain management where patients have to keep coming back for shots. As a matter of fact, as long as we make all your pain diagnoses of those 30 causes and you agree to let us treat all the causes that you have, your pain will be gone. Now, some patients will come back and they'll have other forms of back pain that were not diagnosed because they didn't have those causes of back pain at the time. Back pain can only be diagnosed in a patient when the patient has the back pain. If the patient doesn't have back pain, the cause cannot be diagnosed because you must see where the back pain is coming from, and to see where the back pain is coming from on the exam, you must have the patient having back pain. So when patients have back pain from one or two places and they have a third and a fourth place that's unknown at the time of the exam because they're not having pain from that area, then that area will go undiagnosed at the time. And the only way to diagnose it is when the patient comes back and they're still having pain from those other areas. That's why we go through great lengths to publish for you all, the public, so you can see what are the different causes of back pain, so you can start working it out in your head what causes you might have. You're watching the future of spine surgery right here today at Duke Spine Institute. Our patient traveled from Wisconsin with his wife. He's been suffering with back and leg pain for years. And we're just about finished treating it at the L3-4 disc. He has two discs that are symptomatic, L3-4, L5-S1. I'm concerned there's another disc, the L4-5, but we gave the patient the option of treating it. He chose not to treat it, and that's understandable. People have to decide for themselves what they want treated. Doctors can never force patients to have treatment. They can only diagnose their problem and educate the patient about it, and then offer treatments that are appropriate and helpful to the patient. A lot of doctors, unfortunately, don't do that. They just offer treatments that are helpful to the surgeon, like spinal cord stimulator. Very, very popular treatment because it pays surgeons so much money. They're recommending it to everybody these days. Everybody with back pain and neck pain is getting recommended for spinal cord stimulator. It's a device that's implanted in your body. It has a wire and a battery and a computer, and it stays in there your whole life, but it can get infected and cause a spinal infection, and it can cause an infection in your soft tissues. People have injuries to their spinal cord during the implantation of the device. They become paralyzed, nerve damage, spinal fluid leak. Everybody gets scar tissue with that procedure. So spinal cord stimulators don't work most of the time, They consider success if you have a 50% improvement in your pain, and that's only temporary at the time of evaluation. Over time, that improvement degrades and goes down. That's typically what we see and what's been reported in the literature. But spinal cord stimulators are big money, and the companies that make all that money are promoting the hell out of them. It's like going to the grocery store. When you go to the grocery store, you get what the grocery store is buying. You get their products. You get the products that Procter & Gamble wants on the shelves, whether they're good for you or not. But if a company like Procter & Gamble is making huge profit on a product like, say, cereal, even though cereal may be bad for you, your body, it's unhealthy, people are buying it because it's in the grocery store, and they trust the grocery store. And over time, we've trusted Procter & Gamble. It doesn't mean that they're producing foods that are healthy for you, okay? So you have to be careful, especially today. In the past, people did the right thing. They would sell food that was healthy and nutritious. Now they're filling these foods with fillers that are unhealthy and harmful to your body and your health. But they don't care, because now instead of Procter & Gamble being run by a bunch of people who care about you and want you to be healthy, it's run by a bunch of venture capitalists, private equity firms who have bought in, and all they want is profit. And the way you get more profit is by taking nutritious food, which is expensive and costs a lot of money to make, and replacing it with fillers, which are cheap. You guys remember the scandal about this Chinese rice that came out of China that was plastic. Half of it was plastic. So they were selling plastic rice. Okay? And the Chinese who were doing this, yeah, I see it. The Chinese that were selling the plastic rice, their thought is, you know, it's cheaper to give you plastic rice than real rice. We make more profit if we give you plastic rice. So they were putting plastic rice mixed in with real rice. And the thing about plastic rice is it doesn't have any calories, right? So you're not going to get fat eating it, that's for sure. So that's one benefit. But at the same time, it's unhealthy for you, and it creates all those microplastics, right? And besides, it's deceptive. You didn't buy the rice knowing it was plastic rice. They tricked you, making you think it was real rice when it was plastic. So there's a lot of false deceptiveness in marketing and sales today. And in the biomedical industry, it's really bad. I can tell you it's really bad. First-hand knowledge, really bad. And spinal cord stimulators are at the top of the list. Electronic medical records are at the top of the list of wasted money that's harmful to patients. Harmful to patients. In my opinion, spinal cord stimulators are very harmful to patients. Electronic medical records are harmful to patients. Okay, some of you may be wondering, why are you saying that? Well, first of all, electronic medical records have never been proven to be beneficial to patients. Second of all, electronic medical records consume money. You have to pay Epic or Cerner or whoever's making the medical record system hundreds of millions of dollars for that software, which, by the way, costs them almost nothing to make and implement. So it's huge profit, and they are taking that money away from patient care, because the hospital spends $100 million on a medical record system. Then guess what? That's $100 million could have been spent taking care of patients, doing surgeries for people that needed it, right? So instead of providing patients with needed medical care, stop, is it coming out? Instead of providing patients with needed medical care, pull it back a little bit. Hospitals are spending money on computer software programs that are enriching a few people, like politicians and lobbyists. I know, I want you to take it back a little.
Yeah, but I'm moving the...
Oh, you are?
Yeah.
Take it back a little bit, because I'll have to advance the tube a little bit.
Oh, okay.
Shot? A little more? A little more? Stop. All right, let's advance the tube. Any questions?
At this moment, no current questions.
So the public is being duped by these big industry companies. They're basically replacing your health with their profits. They're taking your health away. Instead of giving you treatment, tests, they're giving you an electronic medical record system that doesn't benefit you at all. Shot? 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 Where do you think that tube ends? Right there? Mid-disc? Yeah, that's what I think too. All right. Any questions?
Yes, we have a question from Lanu on YouTube
Sure.
asking, what's your view on people dropping on their insurance and just pay cash to see a doctor?
Well, I think you should always do what is in your best interest. And when it comes to health, you really should choose a doctor or treatment that is best for you, the patient. And what I mean by that is what is healthiest for you, okay? Not, a lot of people think, okay, I can go have the Duke laser disc repair, pay $30,000 out of pocket, or I can go have a spinal cord stimulator and pay $10,000 out of pocket because that's covered by my insurance, the stimulator, right? But the problem is they get the stimulator and then they have a complication like an infection or a spinal cord injury. Then they are paralyzed, they can't do their job, so they are now home in a wheelchair, no longer able to go and do anything they like to do in life. Is it worth it? Was it worth that $20,000 difference? You saved $20,000 by going with your insurance, but the insurance covered a surgery that basically paralyzed you or gave you an infection in your spine. So now you are suffering from complications of that procedure your insurance covers, which all of the insurance covered surgeries for spine, all of them have histories of complications, bad complications, okay? Well known, well documented. Don't take my word for it, go review it yourself. Find it in Google, okay? So all of the surgeries and treatments covered by your insurance have complications. But let's say the Duke laser disc repair is not covered, and you're wondering, should I do it? Well, you just have to ask yourself, is $20,000 out of my pocket that I was going to spend on a trip, is it better to spend that on a surgery that actually fixes my back pain and doesn't cause me to be paralyzed or have adjacent segment disease or need pain management the rest of my life because that surgery makes my pain worse, like fusion makes my back pain worse, my neck pain worse. So the surgeries you're being recommended by your surgeons that are covered by your insurance are going to make you worse over time. You may not be worse the day you wake up out of surgery. Oh, I'm waking up, I'm not worse. But you're going to be worse a year later, 5 years later, or even 10 years later. And people that have those surgeries and have those problems afterwards, which is probably over 50% of the patients, they know the truth, which is why they come to us after they had that fusion or laminectomy or discectomy or stimulator, and it's not working for them. They come to us and they pay the money. So should you pay that money now when you're young and healthy and you can reap the most benefit from it? Pay that for that surgery that your insurance won't pay for? Should you pay for it now, or should you wait until 10 years later and you've robbed your life of 10 years of good quality living and sleep and health? The answer is obvious to me. I know what I would do. Listen, I'm a consumer of healthcare as well as you all. I'm a consumer. I have my own medical issues, and I can tell you right now, if I had to choose between going to a doctor and having a treatment the insurance covers, that I only have to pay $1,000 out of pocket, but I know I'm going to be having problems from that treatment the rest of my life, that problems that are serious, I would rather go to a doctor who doesn't give me problems with their treatment, new problems, and that fixes my problem so that I don't have that pain or whatever it is anymore. I would rather pay that. I would pay $100,000 or $200,000 to avoid a complication. Okay, I don't care how much it costs. Health is more important than anything else. Okay, now what has distracted people from the truth, which is health is the most important thing. Your health is the most important thing you have in your life. There is nothing more important than health. Not money, not boats, not cars, not houses, not jobs. The most important thing in your life is your health, period. And this procedure you're watching is the best procedure in the world if you have back pain for your health. Okay, it's not the best procedure for your insurance company payment, but it's the best procedure for you. You just don't know that. But a lot of people have to learn these lessons the hard way. They have to go out and get these invasive surgeries covered by their insurance that don't work. They end up with complications, or they end up with chronic pain. And as a result, they suffer. They suffer every day, and their life is destroyed. But some people don't mind the suffering, okay? Let's face it, there are a lot of people out there who don't mind suffering. They'll just treat their suffering with alcohol or drugs, and they'll get by, right? Sometimes they like the empathy they get. I am not a proponent for human suffering. I am against human suffering. And if you don't care about human suffering yourself and you don't mind suffering, then save yourself the money and don't spend it. Just suffer. But if you want to stop suffering and you want to start living a normal life, then you have a procedure like this. You spend the money out of your pocket if your insurance won't cover it, and you have the very best treatment available in the world that is curative and doesn't have complications and side effects. Okay? It's simple. That's my answer. That's what I would do. I would never choose to compromise my health and have a bad treatment from a doctor or anybody in exchange for saving money. It's not worth it. Human life is too valuable. Our health is too important. Now, not everybody agrees, and that's fine. Everyone's entitled to their own opinion. I'm not saying my opinion is the only opinion or the right opinion. It's the right opinion for me and my patients. All right, we're done. We're going to come back in a moment with another live stream on facet pain treatment with the Duke plasma rhizotomy. Thank you.